Well, good morning, everyone. Good morning, Mr. Gonzalez and your class. We want to welcome Jose Luis Munoz Jr., and he goes by Louis. How are you doing this morning, Louis?
Very well. Thank you for asking.
Good. I'm glad to hear that. So we're going to talk today about a topic that I don't think we've covered before, which is being a surgical technician.
Okay.
So I want to welcome, first of all the students who are watching. It is April. We're going to have one more Cybermentoring in May, and then we'll take some time off. I do want to remind you that we are recording this, but I have the chat open. If you have questions, you can put your questions there. And also in a little bit, we'll allow you to unmute yourself so you can ask questions. So Louis, tell us a little bit, first of all, about your background. Where are you from? Where did you go to school? Tell us a little bit about yourself.
Well, I was raised in the Valley. I grew up in Harlingen. Before I got married, so I was a mixed martial artist. I fought professionally for about 10 years. When I got married, I realized that I couldn't do that for a living for long without paying the price with my body. So I went to school and to teach this here in Harlingen, and I saw a friend of mine sitting out on the bench, and I went up to him like, "Hey, buddy, what's going on?" And he's like, "What? You're in school?" Because I wasn't the school type.
Yeah.
And I'm like, yeah, no. I needed time to grow up, and he's like, "Well, I'm in a surgical tech program." I'm like, if he can do it, I can do it. Now my buddy is Dr. Muniz. He's a pharmacist from Harlingen. But yeah, that's how I started this path.
Well, I think it's very interesting when people in a medical profession talk about not being a good student, because you have to be a good student. You have to have good steady habits to go into that field. So tell us a little bit about when you were younger. How did you manage that?
Well, I found out I always struggled with school, and I always thought it was because it was of me.
Right.
So I was discouraged. I had trouble reading. I stuttered. I found out when I was 23 that I was dyslexic. Okay. And then through the resources that the state provided, they showed me that it was the way he said, "Look, this is a smart man disease. You just need to slow your mind down and take your time." Right. And gave me the tools to be successful. And finally, as I started this journey, I started having more confidence in myself, to the point where today I run my own company. I got my bachelor's, and I'm applying to medical school. A father of 6. So you know what? I'm a big believer in second chances, and the fact that sometimes too, if there's a problem with school, I don't think it's the individual. Most people with normal capacity can do well in anything that they set their minds to. And that was the difference. Is I was discouraged because I thought I couldn't. Deep down, I thought I couldn't do it. It was the fact that I was able to.
That's very interesting. I always, that happens a lot in the medical field. Yes. You'll hear people who say, "I wasn't a good student," yet they're in a profession that takes a lot of studying, a lot of practice, developing skills. So I think it's really important for students to hear that. I think it's very interesting also that you have a lot of certifications. My son's a paramedic, and he's an instructor, and he has a lot of certifications also. Yes. So tell us a little bit about the certification process and about all of the different certifications you have.
Okay, so I'm a CST, a CSFA, and an LSA.
Tell us what that means.
Yes, I'm going right to, because it's a lot of, so I'm a certified surgical technician. So I went to school, got my associates in surgical technology, and I had to sit for an exam. With that, I got my certification to practice surgical technology throughout the US with that certification. Next, I became a certified surgical assistant. Now, in order to do that, you have to be in the profession for 2 years minimal, and then go to school for a year, and then take an exam. Okay. And that gives me a national certificate to be a first assistant. Some states, all states recognize it, but our scope is limited in different states. Like in Texas, we're very hands-on. It's equivalent to being a PA in surgery. It's a wonderful field. And then in Texas, they have a licensure for the first assistants. So that one is that I have to prove the state of Texas that I have over 2,000 hours of assisting. They run a background check, and it's a legit medical license. And you know, that took about a year after I got my surgical assistant, my CSFA, to be able to apply for the licensure.
Okay.
So, and every 2 years, I have to submit my hours payment to keep my licensure up.
Okay. So with the certifications, I know it means that you can do more. So tell us, and I know every time I ask this question, I get a chuckle, but what's a typical day for you? I know typical isn't probably typical, but tell us some of the things you do in the course of your day.
Yes. Okay. So first things first, the day before or like Friday or whatever the day before surgery is, that we'll get a list of cases. So what I do, and I encourage others in my profession, is to, if it's a case that you don't know, or a doctor you don't know, because sometimes you don't work with the same person, is find out, you know, doctor's routine, find out the surgery. We're big on anatomy. Every case is a little different. So once I reviewed that, so I can be prepared mentally what we're doing, I show up in the morning. Our cases here are pulled for us, but I got to go to the bins, make sure that everything is pulled accordingly for the doctor preference for the procedure. So once we've gotten the green light from our nurses that the patient is going to have surgery, we set up. So our main role as surgical technicians is to maintain a sterile field. Mm-hmm. So that means make sure that we open everything with care, make sure the items are not expired, make sure there's no holes in the drapes, make sure the sets are sterilized. And with that, there's processes in place for that. But that's right. The whole part. Make sure that the physician has everything they need for the procedure. And then our job is, once we're set up, is to maintain that sterility. So that's our job, is to protect that sterile field. Nothing's going to happen to it. Right. Patient comes in the room. We usually break. That means because we scrub in sterilely, put gowns, gloves, the whole, and then we help the nurse position the patient, prep patient, drape, and then we start the case. And then we got to make sure the doctor has everything they need, from the scalpel to the scissors to pickups, needle holder, suture, whatever it is for the case. That's how we go. And usually, like, I specialize in cardiothoracic, but it's not uncommon to work 8, 12 plus hour days. It's just right. What we do. And we are on our feet a lot, but this is a beautiful field, because you're actually you're helping a surgeon perform this. You're involved in this patient's care. You're hands-on. In order for us to be successful, we have to work as a team. Right. So yeah, that's our typical day. Now, as a first assistant, my job's a little more. I do all the same things, but I put in line for the doctor. I put in Foley's position, and as assistant, I actually will help the doctor start the case, and then I'll finish the case. I'll close the incisions. I'll put the dressings on, and that's what differentiates for the assistant from the technician. From the technician. Yes.
Okay. So tell me a little bit. Let's go back to school. Yes. What were some of the things you had to take then to prepare to do this job?
Oh yes. So I just reviewed it. So surgical technician, to be that, we have to have your A&P 1 and 2. Microbiology, you have to have a psychology, you have to have an elective, and then you have to have your histories, governments, your basics. Other than that, right. But it's very big on your anatomies and your micro, or the two, and pharmacology, forgive me, is the core for the program.
Okay. And there are certifications and then degrees. So what are the different levels? Because I know some students want to get a certificate so they can start working right away. Some are willing to get an associate's, and some are looking for bachelor's. So can you tell us the different levels of education?
Well, back in 2005, I believe, we got away from the certificate and made it all associates.
Okay.
Now there are recommendations that encouraging our profession to seek bachelor's degree for us, but it's all you need to become a surgical technician. Everyone has an associate's program. Right. The certificate is no longer in existence because of the amount of college hours you have to take to become a technician was over I think 90, which is more
Right.
than, so it was like, there's no point but to offer it as associates.
Right, right. Well, then students get the benefit of that. And for students
Yeah.
to know, an associate's is usually 2 years. So that's,
Yeah.
you would be in school for 2 years to be able to go into this field.
Yeah.
So and then what? Is that it? You 2 years and you're this, or there's like you did more. So tell us what other certifications are offered and what else you can do.
Okay, so for instance, like I wanted to do more because I saw these people that were cutting, performing surgeries with a physician, and I was fascinated by it. I'm like, that
Right.
looks amazing. And for that, you needed your 2 years in, and then you would have to go to school to a first assist program, and that's usually about a year.
Okay.
Now after that, then that's where it starts. You get the fork in the road, and you can do a little more things. So like me, I have my own business. So
Right.
I finished my business undergrad because with the first assisting, you can actually bill for the surgeries with patients that have private insurance. So
Kind
you
of
can
contract.
yes, and
Okay.
that's what I am. I am a contract DHR because of my skill set. So there's a lot of opportunity. It's not just work for the hospital. This is one of the last fields that actually, if you're able, if you have a skill set, they can pay you for the skill set. Like I teach residents, I teach other first assistants, I teach surgical techs. I enjoy. I also ran an OR for 13 years in Harlingen, and all this because of and I thought I'd never do that because it's really a field for a nurse. But
Right.
the times are changing where you can go on and get your bachelor's, you can start your own business, you can do contract. I mean, you can get your bachelor's so you can work for a rep company, like a surgical equipment device company. And some of surgical techs are even becoming managers. I know in Harlingen at one of the surgery centers, the person who runs it, Mr. Juan Sanchez, he's a surgical tech CSFA who got his master's. Now he runs the whole surgery center.
Right.
So yeah, the sky's the limit once you're there. Or like me, I'm trying to get to medical school.
Okay. So you're applying to medical school locally?
Yes, ma'am. UTRGV.
Okay. Well, congratulations and let's hope for the best. So beyond being that, what are some things if a student was in this field, what are some areas that they could go into? Like you're want to go into the medical field, but what else could people go into?
Oh goodness, you can be over the central sterile department because now the school is actually graduating the students with dual credit. So you graduate. Okay, so going back to the school, I think TCC started off where now that they offer the students a certificate and central sterile, which is the people who wash our instruments and sterilize them. So they come out with that, and then they also come out with their certification. That way they have a tool. That way if ever they wanted to branch off, they can do that. I know you can branch off into different specialties, all across from OB-GYN to cardiac to orthopedic to general surgeries. So you can also branch in education. Right now, a lot of the surgical tech programs are in need of people that are in the industry to teach the next generation.
Right. No, and that's part of the reason we have the PATHS program is to start making those connections between students and higher ed and fill the need along the way. So I'm glad that you brought that up because going into education is a big part of the healthcare field.
Yes, most definitely.
So what you brought up teamwork, and as a teacher, I've always told my students that being on a team is important and you're going to have to be on a team. And but I want to know in reality how important being on a team is in your profession.
And this is what I tell, because I've been the lead for many years, and I always say I can only do what I do because of my team. If it's because of my team, I can focus on the surgeon. If it's my team, I can focus on the patient. I don't have to worry about them. So it's crucial that every member of the team does their role. We all have different roles. And I'm also part of, for instance, when we're going through what I do, everyone in my team is encouraged to grow. No one's going to be complacent. So if you're a surgical tech, I want you to become a CFA. Right. If so, I'm going to show you skills, because the whole thing of it is I believe in teaching your replacement. So we can, it was given to me and it's given to them. So when I teach for free, but my only requirement is whoever I teach is one day you pay it forward, because it was given to me. That's all I ask. I'm going to teach you. If you want to learn, I will show you, but you need to play it forward. And the most important part is being able to work together. Put aside anything that is not pertaining to the patient. I mean, to whatever is patients first.
Right.
Yeah. Home life, that I get it, but we're here for the patient, because while the patient's in our care, they have to be the most important person in the world.
Mm-hmm.
They're your mom, they're your dad, whoever is the most important person in the world to you, that's who this patient is, that during the duration they've entrusted their life with us.
Yeah.
And I teach that to my team, because that way we don't lose, because it is a job. And sometimes we can become disconnected because it's a job. And we need to always stay focused on our patient.
Yes. So who is on your team? Like, I know there will be the surgeon, there's you, but who else will be involved in caring for your patients?
We have our anesthesia provider. It could be a doctor. It could be a nurse. We also have our nurse, our circulator, our RN, and sometimes we have an anesthesia nurse, which usually is our LVN. We also have a surgical tech and another first assistant, because we specialize in cardiac. It takes a few more people to do so.
Okay.
But in a general team, it's going to be either 2 surgical techs, 2 CFAs, or 1-1, a nurse, and then the anesthesia provider. That's our usual normal team for the case.
Okay, good. So tell us the best part about what you do.
Okay, so honestly, I truly enjoy doing good work, knowing the fact that no one knows what we do, and I'm okay with that. But the fact that people get to go home, because in cardiac, it's about prolonging life.
Mm-hmm.
Knowing the fact that we help someone go home and spend another 5, 10, 15, 20 years with their family is what brings me the most joy.
Yes.
I could have retired almost 15 years ago if it was fulfillment. So I was getting ready for a case, and one of my CS goes, "Hey, why is your doctor giving chest compressions?" And I run into the room, and my doctor's and the patient was not doing well. So I started doing chest compressions. I ended up doing compressions for 45 minutes, and I was exhausted, and I still had to scrub in, assist the doctor, take the vein, give it, and I was drenched, I was exhausted, I was done. About a week later, I get a phone call. My boss goes, "Hey, doctor's looking for you." And like, "Oh man, am I in trouble? What did I do?"
Did he send to the principal's office?
Yeah, I'm like, "Uh-oh." I'm like, "No, I've been good." So I go to the front lobby, and he's sitting there with his cup of coffee, and I see him looking at the door, and he goes, "You see that?" And I see this woman being wheeled out in a wheelchair, and he goes, "That was because of you." I go, "Now she gets to go on to her grandkids." And I go, that to me was, that day I could have finished retired, because that was something that I'm like, you know what? Thank you, because I took part in helping someone spend more time with their family.
Yes, definitely. Definitely. Well, students, I want to remind you that you can put any questions that you have in the chat. I know that you're not shy. Don't be shy. And if you have questions, put them there. So we talked about the best. So let's talk about the most challenging part of your job.
And what we do is life or death. And unfortunately, we've had those that our best wasn't good enough.
Right.
And that's the nature of our profession. Not all surgical technicians have that, but when you're specialized, like in cardiac, like I do, where it's the heart, and the most challenging part is, like, I remember everyone that we've lost, and I tell my team, I want to make sure that when we go home, that I can say we did our best.
Yes.
Sometimes things happen. Patients really sick, they wait too long, and our best is not going to be good enough because patient didn't get to us in time, and that's okay, because I can put my head down and say, you know what, we did our absolute best, and unfortunately, it was just not in our hands.
Mm-hmm.
That's, to me, the hardest part, because I've literally done thousands upon thousands of surgeries, but I remember everyone we've lost.
Right. Yes. I'm sure you do. I think it's very interesting that you were talking about being able to contract, because I think that's a fairly new concept to students, that you develop your skills and then you're able to contract instead of working for one place, you're working for many. So can you talk a little bit about contracting out your work?
Of course. So what I specialize in cardiac is that we take the greater a vein in your leg, and we use, and it's like the new pipe for your heart, new coronaries,
Right.
or artery in your arm. And the old ways was one big incision down your leg, and I do it through small incisions, through 3 incisions, because of I use a camera and scope, and I happen to be really good at that. It was a gift. I got a knack for it. So with that, there's not many people that do what I do. So especially in Cameron County, and even here, there's still a need, for it. So with that, I started working for a hospital in Harlingen across the street. And I was a part-time employee, but I realized it was a little tasking trying to do with all their education. I'm like, I don't have time to go over there. I'm full-time. So I'm like, can we do something different? And they go, we can pay you per case. I'm like, sure, let's do that. Yeah. And that's how I started my role in the contract. It was just, I couldn't make their education. So now with Baptist, they give me a list. They pay me a flat fee for every case that I do. And since I do a lot of specialties, that so whenever they need me, they'll call me and I'll go work a day over there. And they pay me per case. Now it does take about 45 days to 60 days to get paid. So that's one of the things you'd have to know doing this.
Yes.
So you want to build up a little nest egg to make sure you can get through that hump waiting for it to get paid. HMC pays me a flat rate for every case. And DHR pays me, like, DHR is my primary, like, right now I have contracts for them, but I only help them on the weekends because I'm primary DHR Monday through Friday and the days that I'm called. They pay me a flat rate for my services and I'm available for them Monday through Friday and the weekends that I'm on call. And so it's a negotiated price. They pay me for the day and I bill them.
Take me through the thought process, though, of discovering, this takes a lot of self-knowledge, like to know that you can do something that other people can't do. So I want you to talk about that, because I truly believe this. I will tell you that I'm a STEM specialist. So I was STEM before there was a such thing as that. I just am good at math and science. Yeah. So that's when I discovered, hey, I can do things others can't do. And I'm sure it was a similar. So talk about that a little bit.
I've always, my careers, I was a waiter, I worked in bars, I was a fighter, I always worked with my hands, right? So that was something I always did. I just took it for granted. And I love cooking. So I was, martial artist, working on my hands, hand-eye coordination was something that I always did. And I didn't realize it would correlate to surgery. I would never thought that it would come in, it'd be useful in this field. So I had a knack for surgery. I just understood it. I also grew up on a farm. So, being around, that environment of slaughtering animals and stuff was part of my thing. So it was not foreign to me to see things of that nature. Blood and things were just my way of growing up. And all my experiences, I didn't realize till later that actually helped me be successful in this industry. I never would have thought. Hand-eye coordination, being able to, have a stomach to tolerate some blood and other bodily fluids. And the confidence. I had to be a waiter. I was shy. I stuttered. I didn't want to talk to anyone. But guess what? If you have to work your customers, you got to say hi. you got to say, how can I help you? And you have to learn that. But even then, that skill set taught me to deal with surgeons, with my managers, and not get so emotional, because when you're a waiter, you have to say, yes, ma'am, yes, sir. You have, you're working that tip, so you have to be able to have a smile and work through it. And all those things help me in this industry, how to cope with it can be a little stressful because, things happen, right? Voices get raised and whatnot, but it's just for the sake of, it's not personal, it's for that moment. And all those things gave me the tools to cope with it and the skill set to do it. Like the sewing came naturally, the harvesting came naturally, and I can't even explain it. It just, I understood it. And I think our this next generation, because they're so used to that with the gaming and stuff, they're going to be more prone to things of hand-eye coordination. They don't even realize it.
Yes. I'm glad you said that, because that was one of the points I wanted to bring up. Everything you're doing as a young person, you're developing skills. And one thing that I don't think our Valley kids understand is they have a unique experience simply based on where they live. They think everyone lives the way we do, but we don't. And that experience is valuable.
Yes, most definitely.
And it can be used once you're getting paid. Some of it, let's take speaking Spanish, for example. To be able to speak Spanish is not something everyone can do. It seems like everyone can because of where we are, but once you get out of this area and you find out that's worth money, being able to speak another language is worth money on the job. So I'm glad you brought up the contracting, because I think that's very important.
Or if like there's a lot of actually contracting even for surgical techs, not even for assistants. So if you want to actually go to, you know, like for me, if you want to go to school to start making money, go to school, get your associates. After 2 years, you can travel. You can see the nation and get paid well.
Yes.
Go all over. I mean, I work with a lady here who spent 6 months in Hawaii working. They paid for her room. She goes, I made, and they get paid relatively well. It's probably around twice than someone would normally get paid working a normal job. Yeah. And to live in Hawaii, you know, East Coast, West Coast, all over, she just traveled because it was just her. So there's opportunity to even see the nation and get paid to it.
So tell us the benefits of contracting. I think students would like to know that. What's a benefit of being a contractor as opposed to having a full-time job? Well, which it is a full-time job.
The other than the monetary, obviously that you make more as a contractor because you're only there for a season. What I think what it brings to what it helps you as your skill set, you're able to go to many places and learn to adapt. Yeah. Adapt to the situations. So you can go to Corpus and they do something different, they do it differently, but you learn how to do it there. Then you go to Arkansas. So having all that skill set, learning to adapt, I think it will help them in the profession because they can work anywhere and adapt. And that's the most important thing, working with different people. And it gives you that sense of confidence because you're able to, you know, you've worked all over this nation and you've worked with thousands of different doctors and you're able to do it well in each state.
Thank you for bringing up contracting. Students, if you have questions, make sure you put them in the chat so we can ask Louie. This is something we've never talked before, being able to contract out the work that you do. And either instead of having a full-time job with a certain company or in addition to having a full-time job with a certain company. So that's good. What advice do you have for students who are interested in going into the surgical tech field?
I would honestly, I treat education like any other business. You got to find out, okay, how are you going to pay for it? Where can I go to school? I know there's a school here in the Valley. There's a school in San Antonio. So all those are variables, how much it's going to cost you. But also, and I'm not just because I'm biased because I went there, but obviously the one in Harlingen is one of the best schools in the nation. And it's just, the way they're structured, they prepare you very well for your field. So if you're looking for one of the best programs, right here in the Harlingen is your best bet. Now, sometimes you want to go to San Antonio or whatever. There's one in San Antonio that's a decent school as well. It's just pick a school that's where you can get in and get out without struggling with because when you work in the school that year, you're going to work very little. So if you need to work going to school, you have to prepare yourself that it's the amount of homework you do. It's possible to work a little bit, but working 20, 30 hours a week is probably not going to happen. See, if not, you'll fall behind in your schoolwork. Right. So preparing yourself for that journey is, I think, the most important part is, okay, so I need to go to school. I'm going to have to work very little. I worked all through college. So it was not easy. Now, I was fortunate that I worked in areas that I worked Friday night, Saturday night, and only worked 4 hours a night, but I couldn't see myself having to work, 30 hours and keep up with my school load. So I guess knowing when you're going into actually any medical or any program in general that you get applied to get into, you have to prepare yourself that I may not be able to work. I have to prepare myself for this future I can focus on school. I think that's the most important part is preparing yourself for that journey. Because can it do it? Yes. Any school will give them the same opportunity to become certified, same opportunity to become employed. Also, too, when they become employed, no matter if you do contract work or you're employee, you're technically still contract work. You're still self-employed. See, it's a contract. So you treat yourself the same way and you do your job the same way that you are a self-employed individual that made a contract with a hospital and they're paying you, the contract is they're paying me this amount of money for my hours, for hourly, and this is still a contract.
Right.
And approach everything that way, and you'll be successful.
Yes. So let's change to the student's point of view. So I've gone through school, I've become a surgical tech. What can I expect when I first start out? Tell us a little bit about that.
When you first start out, you're going to go to wherever you work. The whole thing is, okay, it's what do you feel comfortable with? Because during the school process, you'll get your hands on a different array of surgeries, because it's part of our first to graduate you. And then you're going to feel stuff that you enjoy more, you comfortable more. So when you come out, most hospitals will start putting you where they need. So it'll be a little uncomfortable. So for instance, if you like general surgery, but not orthopedics, but they'll put you orthopedics, you know. Also too, if you have a knack for something, sometimes right away you can get drawn to a team. Those are the two variables. But for coming out of school, this is the advice I tell all the surgical students. The next 2 years, you make sure that every time you're in the case, you are the one doing the case. Because most places take turns. Like there are two techs, one assist, one passes, one assist, one passes. Because you can still assist as a surgical technician, it's just you're limited to what you can do. What I recommend to all students, make sure try for the first 2 years, run every case so you can have that foundation. So when you want to grow, you have a good foundation experience of understanding the back table, mastering it, anticipating the doctor's needs, because that's what sets you apart, is knowing what they need before they ask for it.
Yes. And what can a student do now while they're in school to better prepare themselves to go into this field?
Okay, so I know they do take some kind of anatomy in high school. They do take these things. I recommend if medical field is what you want to be, I recommend when you take these classes, don't take them to pass, take them to learn. I see, I'm in college now, and I see a lot of students are just trying to pass the test instead of learning it. And I think if you can learn your anatomy now and learn it and try to keep up with it, it's gonna set you apart. Because everything we do is based on anatomy. Because if you know what area of the body we're working in, you'll know what instruments you'll need. You could also, if you're interested in, you can, there's resources available with books would tell you what instruments are what. That would be the second. If this is something that you think you're gonna want to do, yeah, start learning it now. So when you go to school, you're already ahead of the curve. And take see if your school will set up a visit with the surgical tech program in Harlingen, because they do have tours, so you can meet the instructors. They can give you, and they can show you everything it's about, and volunteer at the hospital so you can take a look, see if that's something you want to be. Say, I think I like this, or I don't. That way you know.
Yeah, I agree with you. I think it's just as important to find out what you don't like as it is to find out what you do like.
Yes, ma'am.
Take care. Do you have any last words that you'd like to give before we close up?
And for the program, no, but in general, yes. Believe in yourself. Because, and I don't mean in a negative way, every successful person is just like you. They just decided to do something about it.
Right.
Believe in yourself. We can always make excuses of where we're from and what we're lacking. But each of us are special, and it's in you to be successful if you can be determined to do so.
I appreciate it. Thank you, Louis. I think it's been great hearing all about what you do and the advice that you have for kids. And I want to thank you for joining us. And students, thank you for joining us. Have a great day, everybody.
Bye.
Bye.